Good morning. Good morning, everyone. I hope you had a great morning with the first breakout session. I'm excited to be here. Before I begin, I just want to say thank you to Dr. Paul Osteen for welcoming me to speak on behalf of Hope Through Healing Hands. It's an honor and a privilege to be here with each of you, and we're really appreciative of this unique opportunity. Make sure these don't fall. For the past 16 years, over 3 presidential administrations, I've been called to the front lines of advocacy, which will be the focus of my remarks this morning. I'd like to consider together what is advocacy, why does it matter, and how you, medical mission experts, can uniquely contribute to lending your voice for vulnerable populations around the world. And on a larger scale, what is the role of the United States? What is our duty and responsibility as a nation? And how can we affect change if we choose to? I actually faint at the sight of blood, so I can't even watch some of these presentations. I have to leave. But nonetheless, I too have been called to the front lines of global health. I'm not operating on patients, but I am passionate about how we provide health care, not just for dozens or hundreds or thousands of patients, but how do we care for millions of patients, particularly in developing nations. So first, what is advocacy? For some, it is simply raising awareness for the 800 million people who lack access to clean water worldwide. Others are concerned for the 1 out of 3 people who suffer from malnutrition, a pandemic, if you will, around the world. In my organization, as you saw with Kim Paisley in Haiti, we shot that just a couple months ago. Hope Through Healing Hands has been focusing on the 1 out of 39 women in sub-Saharan Africa who will die from complications of pregnancy and childbirth this year, who simply lack access to contraceptives for healthy timing and spacing of pregnancies. We know the facts, we know the statistics, and those in this room uniquely have the stories to match. Advocacy for some is simply sharing quantitative facts with qualitative, often anecdotal stories to the world to raise philanthropic dollars, which is one beautiful and charitable way to advocate for others. But another, perhaps less practiced form of advocacy is taking those facts, those statistics, and those stories, not just to friends, families, and potential donors to an organization, but to congressional leaders, representatives, senators, the White House. This is a political, justice-oriented form of advocacy. But let me be clear, it is religiously nonpartisan. This advocacy is done regardless of the person or the party in office. This advocacy is championing the protection of U.S. funding for foreign assistance, which has saved and continues to save the lives of millions. Over the past 3 administrations, we've blazed the trail among all nations as the most generous, the most giving country in the world for the world's poorest. So why does it matter? Let me tell you a bit of that story. So for the past few years, the Kaiser Family Foundation and others have polled Americans nationally asking, how much of the US budget do we spend on foreign aid? And Kim actually told us before in the video if you were watching. Over 50% of Americans believe that we spend 25% of the US budget on discretionary funding for foreign assistance. But in reality, it's less than 2/3 of 1%, less than a penny to the dollar. Of the $4 trillion that we spend of the US budget, less than $8.5 billion goes to global health efforts. And what have we done with that 1% contribution for health in developing nations over the course of our generation, over the past 25 years? We have made history. We are halfway to ending poverty, disease, and deaths worldwide. So let's look at a few of those numbers. Rich Stearns beat me to the punch yesterday. He has had a few of these already. Let's look at poverty. Over the past 25 years, we've cut poverty worldwide actually by 74%. If we look at the statistics of people living between 1990 and 2015 living on $1.25 a day, the number of people around the world living on that income has dropped by over half, from 36% to less than 15% of the population. But if you look at the numbers of people living on $1.90 per day, which is what we show here, the decline is even greater. Approximately 1.9 billion lived on less than $1.90 a day in 1990, compared to a projected 702 million in 2015. That's a 74.1% decline in 25 years. And that, in my mind, is nothing short of a miracle. But there are other miracles. Over the past 25 years, we have cut worldwide child mortality in half, as Rich Stearns mentioned as well. And as you see here, the number of children dying from pneumonia, diarrhea, malaria, HIV/AIDS, and other illnesses has decreased from 12.4 million people in 1990 to 5.9 million deaths in 2015. These statistics are even more impressive, taking into account the population increase during the same time period. Over the past 25 years, we've also cut worldwide maternal mortality rates in half. In 1990, more than 586,000 women died from complications in pregnancy and childbirth, like hemorrhaging or anemia or preeclampsia, to name a few. But today, it is less than 303,000. Over the past 25 years, we've also cut the number of deaths from tuberculosis in half. In 1990, more than 3 million people died every year from complications related to TB. Today, it's less than 1.5 million. Since 2000, we've cut global malaria in half as well. More than 839,000 people died in 2000 from malaria, and today, thanks to the President's Malaria Initiative, the Global Fund, and other interventions, less than 438,000, who are mostly children, will die from a simple mosquito bite. There's even better news. If you just look at 57 countries in that slice with malaria transmission in 2000, the reduced rate is actually 75%. And finally, it's estimated that more than 7 million deaths have been averted by the immunization programs for over 500 million children around the world, thanks to the funding from the Global Alliance for Vaccines and Immunizations, or Gavi. And perhaps the best story of all, over the past 15 years, we have turned the tide on HIV and AIDS. When President Bush declared HIV/AIDS an emergency in 2002, less than 50,000 people in Africa had access to antiretroviral medications. Today, more than 21.5 million people have access to ARVs. They are living out their lives with their children and their families and their friends and their jobs thanks to you, thanks to American tax dollars. Between the uninterrupted and integrated services of the President's Emergency Plan for AIDS Relief, or PEPFAR, launched by President George W. Bush, and the Global Fund to Fight AIDS, TB, and Malaria, we see the light at the end of the tunnel. The funding for these pieces of legislation has changed the course of history. I had breakfast just last month with Ambassador Debbie Birx, who runs PEPFAR, and she estimates that the end of AIDS is only 4 to 5 years away. We have led the turning of the tide of HIV and AIDS, even without a cure, but simply with prevention and care and partnerships around the world. And none of this would have been possible in these brief years without the infrastructure of governmental intervention and the will of the Americans taking a stand, sharing the facts, the statistics, and the stories on behalf of those who otherwise would not be heard. So who took a stand? Who offered their voice at a time when HIV/AIDS in the US was deeply stigmatized, particularly by the conservative right, as a disease of homosexuals and drug users? Well, the chair of Hope Through Healing Hands, Dr. and Senate Majority Leader Bill Frist, took a stand, as did Bono, Franklin Graham, Rich Stearns, Secretary Condoleezza Rice, Chief of Staff Josh Bolten, Rick and Kay Warren, Bill and Lynn Hybels, and many brave others. The leadership of these advocates and their constituencies who championed US funding allowed for the historic legacy of the Bush administration, PEPFAR, and the Global Fund. You may or may not know Bono, lead singer of U2, as nothing more than an artist or an Irish rock star. But to me, he's a friend and a zealous, authentic Christian who wakes up in the morning wondering how he can affect change around the world. How can he use his currency of fame, as he puts it, to save lives? When I worked for Bono as his faith outreach director for the One Campaign, we would often turn to the language of the Old Testament prophets, both personally and to instill a fire among evangelicals to rethink the critical importance of advocacy for victims of HIV and AIDS. I often turned to Ezekiel. My favorite image was God's breathing life back into the valley of the dry bones in chapter 37. Imaging the Lazarus effect across millions of those dying of HIV/AIDS as they had access to ARVs for the first time, putting flesh back onto bones in developing nations around the world. But I've also heeded Ezekiel chapter 22, even today, as we consider foreign assistance writ large in this administration, because the budget for the 1% does remain unpredictable. Ezekiel writes, "The people of the land have practiced oppression, and they have wronged the poor and the needy. I have searched for a person among them who would build up the wall and stand in the gap before me for the land, so they would not destroy it. But I found no one." So who will be that man or that woman to stand in the gap? Will it be us? Will it be someone else? Let me tell you a story about a medical missionary. About 25 years ago, Dr. Senator Frist journeyed on his first medical missions with a missions trip with a couple of saints you may already know, Ken Isaacs and Dr. Dick Furman with World Medical Mission. They traveled to Louis, Sudan, a war-torn village in the midst of conflict and bombing, but they still went to heal the sick and raise the dead and cleanse those maybe not of leprosy, but possibly with HIV and AIDS, as Jesus called his disciples to do in Matthew 10. And Dr. Frist went back with Dr. Furman year after year. Even as a senator, he would travel there in the guise of a doctor, not as a politician or the Senate Majority Leader, and spend a month to 6 weeks performing surgeries and providing care in the most remote of areas. And when President George W. Bush came into office, a man who had never set foot on the continent of Africa, Dr. Senator Frist had access to the highest office in the land. And he would bring home pictures from these medical missions trips, and he would lay them on the president's desk in the Oval Office. And the president would ask about those pictures, and Senator Frist would tell him the stories of treating 3 persons to a bed in Malawi, in an overrun clinic where there was a death sentence to all because of a single KG virus. He would tell them about a pandemic that was taking the lives of 1 out of 3 people in many sub-Saharan nations. And he would relay personal anecdotes and experiences with the growing number of orphans and vulnerable children in Uganda because death was taking the lives of their parents. These pictures and these stories and these experiences all played a critical role in saving the lives of over 21.5 million people around the world. And this is a perfect example of pure advocacy. So what can you do? How can you join the chorus of advocacy? You are in Guatemala. You're in Malawi, Bangladesh, and India. You are there with these patients for weeks, months, and even years. You know their needs, and you know the solutions. So I'm asking you to go upstream, if you will, of the miraculous work you do as doctors and nurses and service providers and philanthropists, and consider the root of the problem of extreme poverty and the possibility of solving global health and development issues with the magnitude of partnerships, including the leadership of our US government. We know it works. We know we have the possibility of making poverty history, ending mother and child deaths, and ending AIDS, TB, and malaria. We just need a final push of American will to do so. So advocacy is simple, it's easy, and it virtually takes no time at all. It's just an email or a phone call away. First, go to house.gov or senate.gov, type in your zip code, and you'll find the email or phone number you need to make a quick 2-minute call or write a brief paragraph to your member of Congress. I would even encourage you to call your members in state office and meet with them just for 15 minutes. Share your stories from the front lines of global health. Let them know about your heroic and courageous work in developing nations and why you care about advocating for US funding to exponentially save the lives of millions. Second, just simply give your congressional representative permission as a leader to vote on behalf of protecting or increasing foreign assistance. Let them know, as a medical missionary or a faith leader, that you want to make sure that we continue to provide full funding, albeit still less than 1% of the US budget, to save the lives of mothers, children, and their families with a mere penny to the dollar. Let them know you support PEPFAR, the Global Fund, nutrition, and maternal and child health. Every account matters. And finally, thank them for their leadership and their support for this funding in this era of fiscal restraint. It's that easy, and it's that simple. And finally, I close with this story from Proverbs 31. When King Lemuel takes the throne, his mother offers him a bit of wisdom as a new ruler. Speak up for those who cannot speak for themselves, for the rights of all who are destitute. Speak up and judge fairly, defend the rights of the poor and needy. The red letters of Jesus, the call of the scriptures, and the definition of religion in James all point to the responsibility and the care of the widow, the orphan, and the refugee, the most vulnerable populations among us. To whom much is given, much is required, and we've been given so much. We are halfway there. We're halfway to ending preventable, treatable disease. We are halfway to ending preventable, treatable deaths. We are halfway to making poverty history. I hope you'll join us. Thank you.